Without treatment, postpartum depression can be life-threatening, and it can affect the life of the mother, the baby, and the whole family. My name is Claudia Canales. I'm a psychologist for Veridian Behavioral Health.
Well, doctor, thank you so much for being on the show. We're going to be talking about postpartum depression, what we used to call baby blues, maybe. I don't know. What is postpartum depression?
It is actually a different condition.
Okay.
Baby blues is what's expected after hormonal changes after a delivery, whereas postpartum is a disorder that, if untreated, can be life-threatening. They share some commonalities like mood shifts, perhaps crying spells. But with baby blues, we have that as a temporary thing. It feels like a river of emotions that just comes and go, perhaps some anxiety, and you expect it to subside after a couple of days or weeks. Whereas postpartum, the intensity and the duration of the symptoms is higher. It's actually a very common condition. 1 in every 7 women experience it. And also, it's not just women. It can happen to men too.
If someone has been treated from depression in the past, are they more susceptible to postpartum depression?
Yeah, they are. If you've had depression in the past or any psychiatric condition, that may make you more vulnerable to develop postpartum. Also, if there is any kind of psychiatric conditions or depression in your family of origin, that might be a vulnerability as well. If the baby has had medical issues, or if the delivery has not gone as planned and there have been complications, may make you vulnerable to develop those. But there are also protective factors, like they found that if your partner is able to stay with you and give you support throughout those first weeks after delivery and hopefully months, then your chances of developing reduce significantly.
At what point in time in these symptoms should somebody reach out for help?
Yeah, there's not like a single symptom. Well, if you notice that you are having thoughts of harming yourself or your baby, certainly reach out for help. That would be one symptom where you're like, go and call a doctor, let's figure this out. However, outside from that, there's not necessarily one symptom, but taking everything into account. If you stop feeling like yourself, above and beyond what you would expect from having had a baby, note that PPD is not caused at all for anything that a woman does or a parent does or doesn't do. It is a natural condition that can take place. So if you just recognize that you are being overly tired, not being able to have energy, your concentration is off, you're not being able to focus on things, you're feeling really anxious or irritable, you're not taking care of your baby, having trouble bonding with your baby, any kind of combination that may lead you to feel, gosh, I am not well, it's a good time for you to ask for help.
If interested, for additional information, please visit www.veridianbh.com or call Veridian Behavioral Health at 785-452-4930.